the audience for questions.
Just speak loudly.
It's such a big room. Okay. So I have two questions. This is really fascinating, by the way. Thanks, Cindy, for this. And one is just about the kind of I'm just curious about the study itself. I mean, because you started out saying how these are people who are truly concerned about the situation. They're not, cruel people, and trying to do something. But I wonder what was the intended goal of the study in terms of social impact, like not in terms of the academic results or the knowledge results, but in terms of social impact, and compared to the drug testing study, because I know that methadone is given to people who have become addicted to heroin and want to stop using heroin, but you can't just suddenly stop using heroin, and so it's given in this controlled way, and you gradually are taken off it. And so I assume that study was trying something like that with heroin. I assume the goal was to be off heroin, or maybe it was to be on a sustainable amount or something like that. It seems like there'd be some kind of really concrete goal in terms of the lives of the people affected. But then, what was the goal for the housing that way? The housing study. I mean, was it really? It doesn't sound like there was ever an intention to provide universal housing or something like that. And maybe I'll just ask this question first, and then ask the other one.
There are some important differences between the two studies that also were inflected in the ethics review process. I will say there were a few sleights of hand that occurred in the original process of approving the studies. And there were 17 ethics boards that saw the study. We were never able to find out who provided the first approval. So our board was told, this is before I went on the board, just before I went on the board, but I was hearing things in the community from social workers who were preparing their clients to say the right thing to get housing. So people who were like, try to seem really stable and sane, were now being told, seem as crazy as you possibly can, so that you'll be seen as a good candidate for the study. So this is what I had been hearing, and I was hearing about the people being kind of bumped off of waiting lists as a result of the, suddenly grabbing this batch of housing to put into the study. So when I came on the board, it was a done deal. So I began saying, how the heck did this happen? And one of the things that the Vancouver, our university, was told was that it had already been approved by all the other universities. And we were more or less obliged to approve it. Right? That we would be seen as kind of bad players. We're the lefty university, and we're already kind of like suspect. And so we would be seen as, there's our university again, causing a problem for everybody else. And that we would kind of be thwarting the whole process. There was also a really progressive city council, and we have our equivalent of your DPP was in power at the time. And so the members of our local representatives in this area were also NDP members. So there were a lot of really, really, really progressive people who were kind of putting their stamp on the whole thing. So I got through ethics really, really quickly. As I began to raise questions, and I'm assuming that there were other people like me on other ethics boards, but we requested as a board to contact other boards. We were not allowed to do that. So there's a lot of, who the heck knows what was actually going on these other boards. We were just told, you're the only board that has a problem with this. And I just found that kind of hard to imagine. So as we began raising questions, it turned out that Mental Health Canada and Health Canada had struck it as a kind of internal grant. And in fact, they had no ethics board. And in fact, they had no scientific review board at that time. So in pristine ethics, there are two dimensions of review. One is it a valid research design? In the US, the Ethics Review Board both evaluates the research design and then the other ethical components like consent and these sorts of things. In Canada, that's split. So we have, because basically our entire research enterprise is a state research enterprise, the state adjudicates the scientific validity of the grants when they give the grants. And then the ethics boards are supposed to assume that it's a valid research design and deal with the other elements. Well, I sit on both of those committees. So I sit on the research review boards where we're like, you know, oh, there's an ethics problem in this. And people would be like, oh, that's okay. The ethics board will deal with it. So there was a point in time when I was on both sides of this thing, and I was saying, wait a minute, I'm on an ethics board, and they're assuming that we've dealt with this at this level. So there were a number of us who were kind of in this dual position who at that point in time, this is about 8 years ago, said, we have to change the grant review process such that if there's a substantial ethics problem that goes to the research design, like they can't do this recruitment thing because it's unethical, therefore they're not going to have that group of people in the study. Can the study still function if that group of people isn't in the study? So we created a new rule in the grant reviewing process where people could bring up ethics questions if it damaged the research design substantially and the project couldn't go forward. So this was before any of that was happening at all. So Health Canada and Mental Health Canada reviewed the scientific aspect of it, and they, after the fact, constituted an ethics review board. About a year after I went on ethics, and I presume other people were also kicking up a fuss, they created their own ethics review board. It was struck just basically to deal with this particular project. So it was a bit of a unique situation in that it did not, in fact, go through the normal scientific evaluation or ethics evaluation. It just kind of ended up in everybody's laps, and people did what they did, depending on who was on the ethics board at the time. I think I can say this. We asked for, when we found this out, we said, well, how the heck did the scientific review happen? We're like, wait a minute. This looks like the sample sizes are too small. And there seemed to be a whole bunch of problems with aggregating the data across the cities. Like, do you have some kind of city-level variable that you're putting in the mix? Like, how is this whole thing going to work? And so at that point, we actually requested the file, which I think I could probably get if I put a Freedom of Information request in. We got the file that was their planning process for the trial. And as I mentioned yesterday, it did turn out that they had been working very closely with a research team in New York who had done a similar but different kind of process down there. So a lot of the research design was kind of, I would say, not necessarily thought through. We got the list of the people that were on the original board, and none of them were statisticians. They had not one statistician on the original committee of 12 people. They were all like qualitative social scientists. And a few of them were like community partners with no academic degrees at all. And so the research design was kind of like imported from this other study. So that's how the research design came about. So that whole process, we found out about this like over about a 2-year period of time as the project was already going. And so the researchers were also really, really pissed off. And so they were getting statistical experts and various people to come in. So there was a kind of ugly phase when it was like competing statisticians saying, no, that's a good sample size, no, that's not a good sample size. So we learned a lot about like the theory of sample size by being on the board. It was a good education. Okay, so the goal of the study from the beginning was, there were rumors that Quebec as a province was not willing to implement certain housing policies. So the supposed, there's something called Housing First. It's a philosophy of housing that says if you give people housing, they will rally and they'll be able to get their lives together and they'll get a job and they'll be able to get housing on their own. So the researchers apparently believed that if they were successful in Vancouver, that they wouldn't have to worry about the housing that would be taken away because these people would now be functional and able to get housing on their own. So this was their belief. And that was kind of the belief of all the people on the project team. So one of the claims that they made was that we're going to demonstrate the housing first model in Canada. The problem is that the government had already adopted the housing first model, which many people view as a very neoliberal approach to housing. So the conservative government was already in policy using that as the framework. So it's kind of disingenuous for them to say we're going to do this trial to influence the government to accept housing first, when housing first was already, by that time, the norm. And I'll just note that it was a norm against about 30 years of much more socialist social housing. So Canada has a really, really elaborate number of housing ownership and housing rental structures that deal with a wide range of income brackets. So in Vancouver, we have a kind of co-op model. So people of very modest means can sort of own their home over time, or own the part of the building that is their home. It's like a condominium, but it's a different legal structure. So we have tons and tons and tons of stuff like this in the Canadian system. So to be a progressive person and say, we're going to prove housing first works is actually to say we're going to disassemble 30 years of socialist housing policy, right? So there was this contradiction from the beginning. So when various of us were like, you know, this is weird, it doesn't make sense, we were told, oh, Quebec won't go along with this. And so if we do this study of 5 places, including Quebec, then they're all going to have to come on board with this thing. So there was some implication from people who were basically trying to manage our unhappiness as a research board, that we needed to be told that it was a political thing, we should just shut up, just let the thing go forward. So the project had many, many kind of unprovable dimensions. I don't know how you would go about proving that it was actually the case that Quebec was doing something that needed to be managed in this particular way. Even if that were true, I would have argued that doing a research trial, a fake research trial essentially, was not a good way to go about getting our, you know, almost soon to be leaving the Commonwealth group to play along with the rest of us. Okay, so that was highly problematic. The other study, the heroin studies, were also by very progressive researchers. They were quite young. Many of them were they were physician, PhD researchers. So a lot of them had a clinical practice among the people that they were now doing the trial with. So, and I liked them a lot. They were really a really nice and fun group of people. But they were extremely naive about whether the government was ever going to change the heroin control regulations. So their goal, at this point in time, the history of heroin is a long one. I mean, the history of methadone is a long one. There are disputes over time about whether people must stand for life or whether you should get them on and get them off. So heroin is both a detox mechanism and it's also a long-term replacement for heroin. As a detox mechanism, it works pretty well. As a long-term replacement for heroin, it is biochemically worse than heroin. Okay, so one complaint people have now is like, oh, we kind of kept thinking of heroin as a quick or a medium-term way of getting people off of the drug, but that doesn't seem to happen in a lot of cases. And in fact, people end up on it for a lifetime. And so we need to come up with a better way of dealing with the reality that some people just need to be on this drug. And they need to be on a better drug. And the problem with heroin is not the drug itself, but the legal control of the drug, which forces people into these problematic situations. So that was their ambition in the trial. So in my view, they were very progressive and really wanted to do well by the people that they were also seeing as their patients in clinical practice. The problem was they thought they were going to be able to get the government to do something that they had no reason to imagine the government would do. The researchers on the Shea Swap project, I'm not happy with those, and I know a lot of them. They're my colleagues in the hospital setting and in the academic setting, and it just was like, a couple of them were just really taunting the research ethics board. We basically were dogging them and going to every single paper they gave so that they knew we're watching them. So there was like a team of graduate students who were like kind of following them everywhere they were. And they would like try to get us to talk about what was happening on the ethics review board, which of course we were not allowed to do. And so we would sit there like, fuming. And I'd occasionally say things like, do you really want me to answer that question? Do you really want to talk about this? Because we had actually shut them down at one point for a brief period of time. There were a lot of issues around how to define adverse events. So in a drug trial, before you start the trial, you enumerate the adverse events, and you monitor for those. In a drug trial, because there's such a history of them being done by pharmaceutical companies, the trial monitoring scientifically is done by an independent lab. So you set up the thing, you push the go button on the study, and then this other group of people is getting the data. And so the original, you'll get a sense of why doing an RCT for a social thing is just crap. Because you simply cannot institute the level of control. We tried to make them do it. We really put them through the ringer. So they tried to mimic this kind of thing. So in a classical trial, you say in advance that